Welcome once again to the Mind series. I'm Dr. Ryan Thompson. I'm the Executive Director of Mind Matters Clinic, and with me today we have Linda Swedlund, our autism specialist, and Susan Deax-Kearns, a marriage and family therapist. And together we'd like to talk to you about some of the options that we are able to offer at Mind Matters for children with autism spectrum disorders. And first of all, just try to explain what autism spectrum disorders are, because I don't think everybody's familiar with just some of the terms that we might use. Autism spectrum disorder includes three different diagnoses or three different conditions. One is autism, which some people are familiar with, something else called Asperger's syndrome or Asperger's disorder, and another one called pervasive developmental disorder. And they all have a shared group of symptoms and signs and things that children are affected with. Three of the basic things that you see with children with autism is they have difficulty with socialization, they have difficulty relating with other people, understanding other people's gestures or their intent. They also have difficulty with communication, both in their ability to speak the word or sometimes in their ability to use their language in an appropriate way. And lastly, they have oftentimes areas of fixations or difficulty with adhering to rules or rigid routines to a point where it becomes disabling for them and people around them. So that's the basic picture of autism. We've already described autism in prior episodes. Along with autism, similar to when we talked about with ADHD, many children with autism don't just have autism. They don't walk into us and say that this is a specific limited thing, that they too also share other emotional and other problems that they struggle with. They can be physical problems with coordination. They can have difficulties with fine motor control and assembling things. They can have difficulties with anxiety, which is a frequent occurrence. Approximately 40% of kids with autism will have an anxiety disorder. Sometimes they become depressed because they struggle so much in the social world or in school world, so they too become depressed. Sometimes it's hard to recognize in children with autism because they don't express themselves very well. But I was hoping to share have you share with us how you look at a child or family system with autism and how you might see some of the struggles they have.
So I'm going to think, like we did in our last series, of certain clients that I currently see. And what I find with these folks, particularly that I'm treating as a therapist, would be the coexisting conditions. So the depression, the anxiety, those are the two primary ones. Also PTSD. A lot of these kids have so much trauma from not understanding the social cues and getting made fun of. It's tragic. And being isolated.
And being bullied and victimized.
And being bullied and victimized
right.
and isolated and confused. You know, a couple of the kids, one of the older boys that I work with there was a suicide attempt, a lot of depression, a lot of isolation, and a real despair because he can't figure out how to make it different. Which is why I like working at Mind Matters so much, because we have a lot of different services. So I might be treating the depression or the suicidal ideation, but I have a social skills group to send him to with peers his own age, where he can learn how to, what's it called? Not manipulate, but how to be a part of an environment and catch on to social cues and have friends. There's an older boy who I work with who has anxiety as his coexisting condition and have had really good results with him, as well as recently he's started dating. And so there's two levels. I was initially working on his anxiety, and we're going to continue working there. I tell this story all the time, but we had a moment in therapy where he had a physical experience of his anxiety releasing, of that terror, of that worry, of that tightness in the body and not being able to breathe, of it releasing, and him having an experience of feeling good inside. And so that's really good. And now he's coming because he's maybe trying to have a girlfriend and doesn't quite know how to do that. So there's still a piece of anxiety about it, but when that kind of thing happens in my office, I call Linda, the autism specialist. I send her off an email and say, tell me about dating. Yeah. So tell me about how to coach someone through dating. And she, as she always does, sends me off a book, and I read it and thumb through it and do my best, and then quickly refer her to him to her for more coaching and that kind of thing.
the point of dating and why you laugh about it, because it is kind of funny, because individuals with autism, with autism, have a significant difficulty reading other people's intent. And we all know dating under normal circumstances is tough enough trying to read male to female and female to male.
Yes.
We all know for men, women are a mystery. If you have Asperger's, it's that tenfold. And so you really don't understand how the game is played at all, and that their games are being played.
Right.
Because they tend to be very concrete. And so children with autism or Asperger's, they sometimes are very blunt with their questions towards the opposite sex, which doesn't always get them the response they're looking for. So that's kind of the thing where you're saying, okay, how can we smooth out those bumps and teach them how to do it just a little differently and make them successful? Because obviously everybody would love to be able to date and have a mate down the road, and that's going to be a measure of success.
Yes.
Usually autism is something we like to diagnose early on, prior to age 3 if we can, because we know that in most studies that we see improvements in outcomes if you identify a child prior to age 3. And in doing that, then what's called early intervention. And early intervention services are primarily gauged or geared towards altering or changing their behavior and teaching them to learn how to communicate. And to give us a flavor of the kind of things we might experience, if I had a child with autism who was 3, and I was going to be coming to Mind Matters, and I was going to be looking for services, or I was going to be approaching the school or elsewhere for services, what kind of things might I expect for a behavior intervention, and what kind of things might we see?
Well, before I get into that, Dr. Thompson, I wanted to mention one thing that I thought you were going to mention, and that's the incidence of autism these days. In February of this year, a huge study came out that the incidence now is 1 in 99, I believe is the figure, or maybe 1 in 100. A huge incidence increase, and the study's concluding that it's not just because we're identifying better, more people are aware, that they say it is a true incidence increase, not really sure why that is.
And it's a startling increase. It's a 57% increase just in the last 4 years, and like an 800% increase since 1980. So it's a substantial increase, and yes, and that's why we're here tonight, really, is because the interest is increased because the numbers are staggering. And if you look at the wave of kids who are going to be coming through our world and through our school system and everything like that, we are not prepared to treat them. And really part of the reason for the existence of Mind Matters is recognizing that tremendous need that is unmet. And that the resources are not available. And you're right, it's a staggering increase, and it's something we all kind of have to prepare for and become familiar with, because we're going to be seeing a lot more kids with autism. So yes, thanks for pointing that out.
You're welcome. Well, okay, let me get back into some of the strategies that that we might use with young children who are on the autism spectrum. Many of these strategies would fall under ABA, which stands for Applied Behavior Analysis, and that is really an umbrella term for methods that use the psychological principles of behavior theory to teach new behaviors or skills and to reduce problem behaviors. One of the most commonly used ABA methods that with young children is called discrete trial training, or DT or DDT. And really what that is a series of small little lessons or trials taught one-on-one, again, usually for younger children, mostly used to teach attention, imitation, maybe some basic skills like colors and numbers, some beginning language. I'm going to demonstrate with Dr. Thompson a discrete trial so you can see what that looks like. Very evidence-based. This has been around since the 70s, is widely recognized as an effective practice. So let's kind of do a discrete trial. This is going to be recognizing colors. I have some little color chips here. Dr. Thompson is going to be my student. Okay, and so a discrete trial, or most ABA, consists of 3 steps. There is the instructional cue, there's the response from the student, and then there's always a reinforcement or a reward if the response is correct. So look for those 3 parts. Okay. Ryan, point to yellow. Yeah, yellow. What color?
Yellow.
Yes, good job. That was a trial. Did you see the 3 parts there? The instruction from the teacher, the response from the student, and the reward, which was the praise. And he seemed to like that. Okay. Then you wait a second and do it again. I'm going to mix these up a bit so he doesn't just remember where the positioning was. Point to yellow. All right. What color?
Yellow.
All right, good work. Now there's a whole correction procedure if you would have missed that, but that's basically what discrete trial looks like. Okay, that's one ABA method. There's lots of other methods out there, and if you really want to get into it, I'm going to show you another book. This is called Autism Spectrum Disorders, Interventions and Treatments for Children and Youth. It really looks at all the different methods and therapies and strategies out there and sort of rates them based on the research that's been done. It's really a great book. Simpson is the author. 2007 is the publishing date, so it's pretty current. Okay, let's look at one other ABA method that's used quite a bit, and that's called PECS. It's the Picture Exchange Communication System. It's really an alternative or augmentative communication system for children, not just, and actually not just young children, but also anybody that has maybe no verbal language or doesn't use language functionally. Maybe they just use it repetitively to recite the ABCs, but they don't use it to communicate. Initially in PECS, what the child learns to do, and the goals of PECS, again, are to demonstrate the power of language. You can use a picture to get things you want, and it's used to teach initiation. So much of the time, our kids get dependent on prompts. What do you want? Do you want crackers or juice? Do you want that? They don't know how to initiate. So a real goal of PECS is to initiate. So we're going to do a PECS trial here, and I'll show you what this looks like. This is going to be sort of in the middle of the whole PECS series, where Ryan, Dr. Thompson, has already learned to discriminate pictures, and I know he likes these things, crackers and a drink. So he has a couple of pictures here in front of him, and I have available the things that I know he likes. Now at this point, he is going to initiate. I'm not going to say, do you want cracker or drink? He's going to initiate communication with me. Oh, cracker.
Thank you.
Okay, that was the PECS exchange. Again, the cue or direction was the pictures being in front of him and also knowing that those things were available. His response was to pick the thing he wanted and to initiate by getting my attention. I didn't say, what do you want? And then, of course, his reward was getting the actual thing. Okay, that's why it fits under the ABA model. This has been used really successfully. Again, it's there's a lot of research to support this, not a ton, but there's quite a bit. And also some of the research shows that kids that get proficient at this, their verbal language begins to come too. So it's a really it's a real popular strategy and easy to implement both at home and at school.
What's important about that is that understanding that one of the primary disabling features of autism for children who can't speak is that inability to communicate. An inability to communicate isn't just because they can't speak, but they can't relate their needs to the parent, and the parent doesn't know what they're looking for. So the parents become very frustrated because the child will just start to cry, or the child will have a tantrum. And if you don't know what the child's looking for while they're having a tantrum, you may just punish them for crying and being a brat. But meanwhile, they really haven't learned how to say, I want a cracker. They haven't learned how to get your attention to say, I want a cracker. They don't know how to ask for help. And that can go on much on through life. This really does develop that skill where they can learn how to initiate those things so they can get their needs met, and then the parents can meet their needs. So there's a lot less frustration on both sides of the fence with that, and it is very important.
Absolutely. May I share one other?
Just one.
Just one, okay. TEACH. It's a long acronym. I'm not going to go into what it means, but basically it's structured teaching. It was developed at the University of North Carolina in the 70s at Chapel Hill. And basically it's sort of a philosophy too, based on the fact that most people on autism spectrum, not just young children, but certainly young children, it's used with them, have difficulties understanding the world. It's very confusing. It doesn't make sense. It's not predictable. And so the goal of structured teaching is to make the world more organized and predictable. And some of the ways they do that are through structuring the physical environment to make sure that it's clear, labeling cupboards, labeling work areas so that people know where things take place, giving kids schedules, picture schedules if they're not readers. And I have a model here to show. This is for a preschool. I don't know if you can see it. It really helps kids calm down and know what's going to happen next. First is circle time, and then there's table time, and then there's a bathroom break. You can use schedules like this at home too. Again, it just gives predictability and structure to the world. Think about yourself and how much you like your own schedule and your own planner, how important those things are.
Which is even more important, again, with autism. Children with autism rely on structure and on routine, and changes in that can be very upsetting for them. So again, similar to what we had talked about in ADHD, having some kind of a plan for them to follow is going to be very helpful, because they become much less upset if they know what to expect, if they know what's coming next. And it's not doesn't change very much. It creates a lot less disruption in the family and for the child. And emotionally, the child does much better then, because they have fewer meltdowns, as we talk about a lot of times with parents.
Absolutely, and it's also easy to build in change when you have a routine. You can just introduce change. Oh, we're going to have a change today. But the kids know that there's this structure that they can fall back on, and it makes a huge difference. I noticed this as a classroom teacher myself. Everything really calmed down once I instituted visual schedules in my classroom. One other quick thing to show, lots of ways to make things visual. Again, people on the autism spectrum too have a hard time kind of organizing themselves, knowing what to do next, what do I need? This would be great at home. For school, I need my backpack, my lunch, and my coat. Get them, check them off. Again, it makes the world predictable, understandable. There's a routine. This is what happens. Another checklist for an older child could be used at home. First, I feed Harry the hamster. Then I put my toys away and built a little reward in here. When I'm done, I get to have a story. It's kind of like a mini schedule. It makes the world predictable, organized, and structured. It can be really beneficial for people on the spectrum.
Mm-hmm. It makes parenting a lot easier.
It certainly does. And we can help with things like this too if you want to call Mind Matters and talk about it.
Great. In treating autism, there is no known cause for autism in general. There are genetic causes, but along with genetic causes, there's a lot of interest because of the substantial increase in numbers and what other things may be causing autism, and that's where the area of interest is highlighted as far as things we can do to intervene or potentially change the outcome of children with autism. There's a lot of research being done in metabolic causes and immune causes, potentially toxic causes, though you have to be careful what that means, but things that may change the way the brain develops that may cause or worsen symptoms of autism. There's been a lot of focus on vaccines, but I think that much of the research in vaccines is not really showing a big correlation, certainly, and if it is, it's going to be a very small amount of children who have autism where the cause is specifically vaccines. Nonetheless, there is a lot of interesting evidence that there may be an immune system component to many kids with autism. There's going to be a lot of different causes, and we're not going to find a single cause to autism. So whenever I approach a child with autism, I'm going to be looking for those other cues or clues that may make me think that there's going to be something that could be another cause or something we could do to change the way the brain is developing, be it nutritional or metabolic change that's going on. There may be an immune change that's going on. A lot of children with autism have very erratic bowel habits, so they can have diarrhea or constipation or bloating. They can become very focused on certain foods, which makes their nutritional status decrease, or they can have food sensitivities that we talk about. One of the ones sometimes you find out about is the dietary change people try called gluten-free and casein-free diet, which is wheat and milk sensitivity. Not all kids with autism are going to respond to a restriction in that. There's been kind of a mixed results as far as studies saying some kids may and some kids may not respond to it, but it's certainly one of those things that you may consider depending on some of the things you see in the child. Similarly, there's some interest in metabolic changes that may show that there's areas where the body is deficient in certain things, and you try to replace those with certain supplements that might improve the function of the body in that way. It's pretty sophisticated to talk about in this kind of an environment, so I'm not going to really elaborate on it, but it's fascinating to think of the possibilities that exist, and to some extent limited success you see when you introduce some of these supplements, that you see changes, positive changes in children's lives. It's not necessarily going to mean that the problem goes away completely, But if you see a 20% improvement, a 40% improvement, that's tremendous in the eyes of the family or the individual with autism. So any improvement you see like that is going to be substantial. So there is ongoing research. It's something I'm fascinated by and like to stay on top of and continue to look for things that are going to be useful in ways of trying to change the course of the autism. And as new information comes up, then we're going to try new directions. The primary thing, making sure though along the way we're not going to injure a child with something that's going to create a danger for them or further worsen their autism or some other part of their body. So making sure it's safe and then looking for potential benefit was really going to be primary concern for us. And we have had benefits and we do see improvements, and it is pretty exciting to see. When you have a child with autism identified, one of the things you want to do is you're going to try to get resources. And if your child is substantially impaired with an autism spectrum disorder, one of the places you would go is to go to Valley Mountain Regional Center, which is a state agency which works with people with disabilities. And if you make a referral to VMRC, as it's abbreviated, they will have somebody come out to the house, and they take an initial intake. And then if they see that there's substantial risk, then they do a formal evaluation of the child. And if they do, in fact, have autism, then they will go on and usually recommend and facilitate getting services that they may need in the form of perhaps like ABA, is what she mentioned, or getting eliciting help from the schools, including speech therapy, occupational therapy, things that may need in that, and then working with the school beyond that to make sure that they're in an appropriate place and getting the services they need. So that's always important to try to elicit those kind of supports. One of the things that is most fascinating working with kids with autism is the socialization is oftentimes one of the most impairing things for children with autism, who then later become adults with autism, who still oftentimes carry those awkward social abilities or inabilities. And so one of the things we oftentimes do when we offer at Mind Matters is what's called social thinking groups or social skills training, which basically children with autism do not have an innate ability to socialize. They lack those very basic components of being able to look at somebody's face and say, what's that face telling me? They talk about eye contact, and many children with autism don't look you in the eye because they don't know why they're looking at your eye. They can't read your eyes and say, is that a look of surprise, or is that a look of consternation? Is that because I'm sleepy? Or are they going to pick up those things? If they're not looking at your face, they're not going to. And usually, oftentimes, even if they do look at your face, they're not actually going to be able to read those things very well. By the same token, they don't understand the intent of other people. They don't understand, is this person saying that to be mean, or is this something they're saying to be friendly towards me? Because two things can be said in two different tones, and one could be an actual threat, and one could be kidding. And they can be very literal in that, and then they get in trouble in school because they get bullied, they get victimized, or they may overreact to a certain situation. So we like to put kids in these groups, and then we try to work with them. And what kind of things do we like to see them develop? How do we work in a group like that? Say we have 3 of our kids with autism, and they're all sitting at a table. How would you work with them to teach them that sort of thing?
I wasn't expecting that question, but
Good. On your feet.
Okay. First of all, what I'm going to show is social thinking, which Dr. Thompson's been talking about, is a way of looking at teaching social skills that's been developed by Michelle Garcia Winter. I'm the book person, if you haven't noticed. Here's the book. This is her curriculum. And her thoughts about teaching social skills is that it's not enough just to teach the skill. Look at someone's face for eye contact. That's not enough. You need to look at the underlying, what is that person thinking about? Why does their face look that way? Thinking with your eyes is what she calls it, really looking at the person and trying to figure out what they might be thinking. Thinking about thinking is what social thinking is. So some of the things you might do at first are, with kids, is teach them how to think with their eyes, what to look at, what could that mean, the use of lots of videoing too, and analyzing the videos. Again, really getting at what other people could be thinking, and then later, how could you change? Should that impact your behavior then, based on what you think they might be thinking? Again, this is for kids more on the higher end of the autism spectrum,
right.
Perhaps a little bit older as well. I think there's still a place for teaching some specific skills, like raising your hand to get attention and not
Acknowledging
interrupting.
somebody when they come in the room.
Greetings,
Sure.
teaching some specific skills too, in addition to the social thinking piece. And I think in groups we do both of those things.
And it's fascinating to watch them coach each other and learn from each other as they do it. And sometimes they're pretty funny. Sometimes there can be funny incidences as two children with autism correct each other on their socialization. It can be pretty funny. Medication-wise and supplement-wise, there's some supplements that are used pretty routinely in children with autism, and they have limited benefits. Medications, when they're used, are really targeting certain behaviors. There's no medication that cures autism, but there are sometimes children with autism who have very erratic behaviors or other conditions such as depression or anxiety that need medication to control or to address those specific symptoms. But there's not really an autism medication specifically. So really, when I use medication, it's going to be looking at certain behaviors that can't be otherwise addressed and that otherwise makes them incapable of functioning in the home or in the school. The impact on the family can be tremendous because children with autism consume a lot of the family's energy. And they become the focus oftentimes, and some parents will put a lot of focus on that individual and then neglect others. How do you work with parents with that? Do you have a minute, since you have a minute?
So specifically, how do I work with parents who
Have a child with autism. How do you help restore the family or maintain the family with them?
So I usually treat the guilt, the shame, the grief with the parents particularly, and also the siblings, suggesting that they do things. So parents have a date night and get out. Families take trips where the child maybe goes off to camp and the family goes away for a trip, and that they enjoy themselves and have a great time, and that they don't listen to what I call their head saying that they should feel guilty, that they stay in the moment and enjoy the time without the child with autism, and get restored. And then when they're back with the child with autism, they can be present to that child with a lot more energy.
Thanks. And it's important to know, as a father of a child with autism, I know that I've gone through my own emotional ups and downs in working with my son. And again, similar to children with ADHD, it's trying to find situations or places where if you're really comfortable with your child and that his autism is not going to be as much of a problem, perhaps. For me, it's going hiking or exploring with my son because it's an area that he flourishes in. He does very well in, and then I can feel good about my experience with him. He has a good experience with me. And so it's, again, trying to find an environment where your son or daughter is going to do very well. And have a sense of humor about it, because there's some pretty funny things that happen with children with autism. And I know my wife and I have cataloged some pretty funny experiences, and maybe in a future episode I'm going to share you some of the really funny stories we have, because they are kind of out of the box, because they are autistics. Thank you again, once again, for listening to Mind Series. We welcome you back for a future series.